Hello, good afternoon, everyone. Glad that you're still here with us. So a warm welcome to our session. The session is entitled The Precision Lead, Is Healthcare Ready for the Age of Anticipation? My name is Dr. Andy Poh. I'm an honorary professor at the University of Birmingham, and I'm delighted to moderate this discussion with three leading experts leading the future of healthcare. Now, this year's forum challenges us to reimagine solutions and systems that are not only resilient but are future ready. And no other sector is more relevant than healthcare, biased of course. Traditionally, our systems have been modeled after models to treat illnesses, yet the future of healthcare enables us and requires us to anticipate, adapt, and act in intervention before disease takes hold. Now, we're already seeing many different shifts around. One shift is the shift from reactive care to preemptive models. Another shift is from preserving health to regeneration and longevity. And the third shift is from episodic care to continuous data-driven insights enabled by emerging technologies. So the question is not whether the future is coming, but our systems, governance, human capital, and society ready for the future of healthcare. Now, to explore this, we're going to make this very snappy. We have three distinguished leaders in healthcare. I'll briefly introduce them, and they will introduce the work that they're doing as well. So Tina Woods, Executive Director of the International Institute of Longevity. She calls herself a system architect advancing healthy longevity, the human exposome, which we'll talk a little bit more, and open health data and AI. Dr. Yacine Hadjiat, Head of Innovation in Health Sciences and Digital Health at Dubai Health, and also Associate Professor of Innovation at the MBRU, and his scope leads advances in predictive, personalized digital medicine. And last but not least, Dr. Jeffrey Glenn, Professor at Stanford University, Director of Virex at Stanford, the Stanford Biosecurity and Pandemic Preparedness Initiative, and Director of the Center for Hepatitis and Liver Tissue Engineering. So we've got a star-studded cast panel, and together they will help us examine the age of anticipation, what is governable, what is scalable, what is ethical, what is human-centered, all important aspects of the future of healthcare discussion. So I'll first start off by asking each of our panelists to give a bit of an introduction, 2-3 liners about what they do. May I start off with Tina first, ladies first, please.
Thank you. So good to be here. And I guess really I wear a few hats, one of which I know the International Institute of Longevity, but really fundamentally what has been driving a lot of my work over the past 10 years or so has really been how to figure out system change to sort of move a very broken sick care model in the westernized world primarily through to a much more wellness paradigm rooted in prevention, and how to do that, which is very tough because we have a lot of reasons why things don't change, and this is why being here is so exciting. And of course we'll probably address some other areas around the world which are very ready to seize the challenge of taking this sort of shift towards a much more wellness paradigm. So I'm very involved in a big international endeavor called the Human Exposome Project, which is following in the heels of the Human Genome Project. And really the idea around that is that our health is actually influenced by relatively through a small proportion of our genetics. Is actually how our biology and how our genetics is impacted with all the exposures that we're faced with across our lifetime, and how we really need to be seen. The design of positive environments for human health span, resilience, and flourishing is really where it's at. And that sort of frames a lot of my work at the International Institute of Longevity, where I'm working with clinics around the world on the cutting edge of science and actually what we can take in terms of evidence into clinics, hotels, spas, etc. And it's been actually part of my work. I see my colleague here from the City of Longevity program, which incidentally won the Foresight Award in the people category this morning. So really pleased to see that. And that's really a testament to seeing how we really need to encourage a very different way of thinking and how we actually generate environments for health and well-being, and moving away from the biomedical model of health.
Thank you, Tina. So as promised, illustrious profiles, initiatives, lots of scope under the belt. Maybe I'll go to Jeff. Jeff, tell us about your work at Stanford and perhaps the other things that you're involved in.
Sure. So I'm Jeffrey Glenn, professor of medicine, microbiology, and immunology at Stanford. Clinically, I'm a gastroenterologist. Still see patients about 15% of my time. But most of the time, we're in a research lab focused on new types of antiviral and anti-cancer drugs, also ALS, fatty liver, and direct Virex at Stanford, which is a Stanford Biosecurity Pandemic Preparedness Initiative, really to build out our collective antiviral toolkit proactively rather than reactively, and also have started multiple companies to help bring these products to the clinic.
Thanks so much, Jeff. We'll touch a little bit more on Virex at Stanford a little bit later. It'll be very interesting to hear your perspective in relation to that. Last but not least, Yacine, tell us what you do and what's your area of focus and specialty.
Thank you, Andy. Good afternoon, everyone. Pleasure being here. So my name is Yacine Hadjiat. I'm part of Dubai Health, the integrated academic healthcare system of the Emirates of Dubai, serving one mission, which is advancing healthcare for humanity with 4 pillars, from education to discovery to care, all enabled by the giving and our foundation. And my role is within those pillars and missions to bring innovation and technology to make sure that ultimately we serve the patient and patient outcome by really embracing multiple work streams under the definition of innovation and technology. But one of the programs that maybe is relevant to this conversation is a program on N of 1 digital medicine. So you mentioned about 3 shifts. I would add a 4th one, which is the personalization, and technology is one of those factors.
Yeah. Fantastic. So, you know, the title actually is The Age of Anticipation. And maybe on that note, Yacine, we'll start off with you first. And we're going to keep the answers a bit snappy and to the point because we've got a whole host of questions to cover. So, Yacine, this is a question on setting the scene in terms of anticipatory health. What does it mean for a healthcare system to be anticipatory? And how far are we truly from the actual state of affairs that we want to be? And maybe in the same vein, you can talk a little bit about your work in both predictive, personalized, as you mentioned, digital healthcare.
Sure. Short answers, and I'll start with the first one. Being on the anticipation angle of healthcare is a major shift, as the healthcare is designed today is obviously reactive, and we know that. We react to diseases and we treat them. There is an evolution, of course. The current setup of the healthcare systems was based on acute hospitals kind of focus, where we go in, either we die or we go out. We moved into more chronic disease management, and we know that with the next chapter is to be a little bit more preventive and more into the anticipation and action before the disease worsens. So that's a simple kind of overview. On the second one, on where we stand and where we are, yet again, the short answer, I would say, from a technological standpoint, we're very close. Operationally, maybe not that close, because it's all about scale-up integration and interoperability, and those remain kind of a major gap in how we really move healthcare from being reactive to an anticipation and preventive healthcare. It's not about the technological vector, it's not about the solution, but really about how we design them, how we integrate them, what is the incentive model, and what is the governance. So there are 2 layers to the answer. We are close on the tools we have to achieve that goal. We are still quite far on how we operationalize really the setup of our healthcare and transformation of our healthcare to truly be in that anticipation. And that one, maybe it's a segue to the portfolio of work we're trying to build in Dubai Health and in BRU and the Center for Innovation. So I mentioned about these N of 1 kind of programs. And really my focus, of course, there is a part that is preventive anticipation, but it's also about personalization. So under the N of 1 program, we have multiple projects, one of them being to try at the individual level to have an objective pain measurement. I refer to that one because it's also funded by the RDI and Dubai Future Foundation, so it's kind of a recognition of that support. But it's also a model where tomorrow we can put a voice, an objective measure for something that is truly only subjective, and also to anticipate it in the way we treat patients, because we could also apply it. One of the use cases is in sickle cell, for example. We know that in sickle cell we can anticipate the episodes and act even before the acute episode. We have other programs, for example, in mental health and digital twins, how we could really anticipate a severe episode in mental health and start treatment and not always running behind, and so on and so forth. I can go all and all, but we have like more than 10 projects and 10 solutions in that portfolio. But again, going back to the gap, the tools that we are developing, the research, the evidence, the technological solutions are quite close to achieve that objective. But what's still missing, what we still need to focus next, is the design thinking, the system thinking, the transformation for scale-up and implementation.
This is a really interesting thing because, you know, the term anticipatory healthcare is not unknown, as you mentioned, right? So the narrative is there, but when you actually look at the actual implementation blueprint perspective, maybe there's some distance in terms of that. So increasingly, we need a system-level perspective towards welcoming anticipatory care and actually mainstreaming it into the main fold and delivery of healthcare. And perhaps this is a good segue to ask Jeff a question. And the question is actually in relation to scientific and clinical readiness. You're a clinician as well, Jeff. So the question is that how we talk about anticipatory care, but how can we make sure that advances in emerging technologies like AI, genomics, precision tools, how are they, and what does it take to embed them seamlessly into actual clinical care? If you could just share your insights to that, please.
Sure. First of all, I think AI and these precision tools and genomics definitely have the potential to predict disease before clinical symptoms develop. But that also raises a whole bunch of new interesting problems. First of all, it changes the risk-to-benefit ratio, because now all drugs have side effects, and now you're going to give someone all the risks, the side effects, and they may not even have clinical disease yet. So the benefit, that ratio is not what we have typically today when you treat someone with disease. More importantly, I would say most of our drugs, if you think about it, they've been optimized to treat established disease or severe states of disease, and those may not be the optimal molecules or regimens to treat early or preemptive disease. So we're really going to have to rethink a lot of how we do things. Now, one area that I work a lot in where I do think it's very relevant is in viral diseases and pandemic threats, because here we can actually come up with very effective preemptive care because we can predict the viral threats and we know what are the right drugs to develop against them. Of course, in my lab at Stanford and my various companies, we use AI, we use these precision tools, genomics, to help develop and commercialize preemptive care drugs. But the important thing to remember, drug development takes time. And if we really want to have something to shut the next pandemic down in Wuhan or wherever it emerges, we need to start now.
Fantastic, and I think you have a slide on the Virex at Stanford a little bit later.
Yes.
So I think that the common theme that I'm hearing is that technology is there, the understanding of what it means to have anticipatory care is there. We need system design. We perhaps need policy, regulatory perspectives to be infused. So there will be a question, by the way, between regulation and how do we facilitate the speed of innovation without holding it back, but yet have certain guardrails to make sure that we're not going towards pitfalls. And this kind of conversation, maybe Tina to you, is quite useful because it brings about a greater conversation on longevity, well-being, I think you mentioned a little bit earlier, and more societal constructs in terms of perspective. And how do we actually amalgamate these, like technology, emerging technology? So perhaps a direct question to you, Tina, is from a longevity and a well-being perspective. We're talking about population well-being these days. What shifts do we need, right, in terms of preventive policy, behavior, mindsets, for societies to be truly proactive about health, and I mean across the board, not just a certain tier of society. And I suppose if you could touch on also the democratization of such technology to society and populations as a whole.
Sure. So yeah, I think that this whole issue of health equity is a really important one. And of course, I operate a lot in this field of longevity, and of course it gets a lot of criticisms in that, oh, isn't that sort of, all the stuff that only rich people can afford? And actually, it is absolutely not about that, because really longevity is all about moving upstream in health prevention and actually harnessing the science and technology that we do have to actually answer the question of N=1 health, because actually that is the holy grail of longevity science and medicine, is actually being able to look at that person in front of you and be able to help them with their health journey, to help them keep healthy and well for as long as possible. Now that is something that everyone should have available to them as a basic right. So I think the N=1 model is really interesting, and of course we do have the technology, the tools, the AI, the quantum sensing, the systems biology to really start to actually capture that data on individuals and actually really start to understand really what does it take to keep a person healthy and well and actually outside of the system of healthcare and needing to see doctors. So we are seeing that actually very complex disorders of aging, like dementia, heart disease, they're all very much clumped together around the health trajectory basically decaying and getting worse. And actually what we're seeing is that there's an awful lot that individuals can do to help protect their health for as long as possible. But actually what we're seeing through a greater understanding of the exposome, which are all the external exposures, and what I mean by that is things like air quality, noise pollution, access to green spaces, closest to nature. We had a very interesting talk about how important nature is actually. And actually the one very underestimated factor in all this is actually emotional, mental and spiritual health, which is hardly entering the dialogue of longevity science at the moment. And if you go to all these longevity conferences, it is absolutely probably the most important thing that we need to understand, that the science, and we actually now have the data to actually shed light on that, the science of human connection, what it is to feel feel connected to our communities, love, purpose, meaning. This has an impact on our biology, and actually you cannot understand through animal studies and in cell cultures and so forth. So this is the next frontier of longevity, which is the heartland of a lot of the work that I'm doing with the International Institute of Longevity, is actually really exploring that space of the next frontier of longevity, understanding human flourishing and what it will take as a community, as an ecosystem, with clinics, with hotels, spas, with food systems, the whole ecosystem that we all have to see this as, and then connecting it, of course, with the Human Exposome Project. So we're speaking and speaking to areas around the world to become test beds. I'm in deep discussion in the UAE for this, because actually the living laboratory of health is actually in our environments where we live, work, and play. It is not where we see our doctor in hospitals. So we have to move upstream. We have to move years and years and years before the pathology sets in. So to be able to do that, and it is hard work because I have a lot of reasons not to change, and ever more so in the westernized model of health. I do a lot of work in the UK, the US, etc. It is about mindset shift. We have to see health differently. And it is about communities, it's about environments, it's about population health, and it is also about individuals and the whole ecosystem. It is also about the system, so system change, and it is absolutely about the incentive structures that either keep a gridlock on the status quo or allow us to innovate and actually do something very brave and very different. So the incentive structures, I think, is the most important thing. Now, we have so much data that gives a very powerful argument for this socioeconomic imperative to see health as an asset, focus on prevention rather than the cure, move upstream in health. There is so much information. I think that's what it's going to take. And the Middle East have done the numbers. They know a healthy person at the age of 65 is probably at its most valuable, productive. They can pass down knowledge. They're still healthy, consuming, being productive in their communities. We have to move that to 85-year-olds and longer. And this is where longevity science and medicine can be really meaningfully harnessed, and then share it with everybody.
Yeah, I actually like the framing this discussion around longevity and well-being, because it puts a very human-centered perspective. So we go past talking about human technology, we go past talking about just the systems design perspective, as Yacine mentioned, and we put a very real human outcome to it at the end of the day, because at the end of the day we're talking about outcome-based approaches towards the future of healthcare. So maybe Yacine, this is a good time for you to, because you raised the system design issue. We know that we need good system design. Now, supposing that we've got good system design policies, we have governance guardrails in place, how do we scale? I think that's a question. So how can emerging technologies, including the solutions that you mentioned earlier, which has a targeted catchment, how can we scale effectively? Are current systems ready? Or do we need new approaches of rethinking about population health? Because population health seems to be the buzzword these days. Over to you, Yacine.
Yeah, I think it's back to maybe, I'll try to simplify the equation, and it was mentioned a few times. So the equation will have a few components together. So the innovation, you go and challenge a process, you reinvent, you add value to a product, to a system. After that, you have a governance. Okay? Governance, and usually you try to have it by design and as early as possible, and not an afterthought. After the governance, you have the regulation. Without regulation, your scale-up will face a wall and will fail. At the end, you have the incentive model. That was exactly just mentioned. Without an incentive model, the scale-up adoption will not work. If you have an absolutely amazing process or a product, your adoption rate will be good enough for a certain level of scale-up. But if your added value is somehow limited or facing that incentive model challenge, you will not scale it up. You will not just convince people to do it because your product is fancy. And that incentive model, it can be multiple then sub-models and discussions like the value-based care and system reimbursement and so on and so forth. But without that last seal, your scale-up will always be limited. If you are lucky and you have a golden shot where you can absolutely come with a product that will shift the entire process with a massive added value, maybe you can survive without it. And because your friction point is low. Without it, that equation from innovation or invention to governance to regulation to incentive is exactly what makes it work and last for a sustainable way.
This is a fantastic, it's like a mini healthcare symposium of sorts, right? Because there's so many concepts to deal with. I mean, you brought out incentivization, we have population health, and then you talk about, okay, how do we align the various stakeholders within the well-being ecosystem, the health ecosystem. You spoke about exposomes that has direct relation to social determinants of health, because we know that there are non-healthcare factors which are going to impact upon healthcare outcomes. So you have this systemic level perspective of approach towards optimizing and transforming healthcare. And perhaps it's a good time for me to divert another question on collaborative ecosystems to Jeff. Because Jeff, you mentioned that you're involved in some system-level initiatives involving ecosystem approaches, right? So the question here is about partnerships. What kind of partnerships, and I'm talking about not just necessarily just partnerships between, like the payers and the healthcare providers. I'm talking about between academia, health systems, industry. What kind of partnerships are most critical to accelerate anticipatory care and precision healthcare? And I think we have a slide. Would you like us to put up that slide if you can? Yeah.
Yeah, so that's a great question. I would say I'd add government and national leadership to that mix of stakeholders for effective partnerships. That's what we really need. We need multidisciplinary, high-functioning teams that can deliver solutions ahead of time to predefined health threats. And so Virex at Stanford is an example of that. So we have a visual here. It's the Stanford Biosecurity Pandemic Preparedness Initiative. The mission is really to build out our collective antiviral toolkit proactively rather than reactively. And we really combine the innovation of academia with the rigor of industry, also government, healthcare system partners. And of course, because pandemics are global, we've been setting up hubs around the world. So for example, we have a Virex at Stanford Vietnam for tropical diseases initially, a Virex at Stanford Mongolia for liver disease, Virex at Stanford Brazil. We have a great phase 2-3 clinical trial network where we did our phase 3 study of interferon lambda for COVID, still the best drug for COVID. And really what I'd like to do here is set up a Virex at Stanford UAE or GCC or Dubai, focused on our AI for drug discovery and development efforts, as well as formation of new companies, in addition to MERS and fatty liver, which is relevant to the region. So the next pandemic is coming. It's not a matter of if, but when. And what I worry about most is an influenza pandemic, because we know that can kill hundreds of millions of people. That'd be 50 times worse than COVID. And so in COVID, there were some societies that were on the edge. So imagine something 50 times worse. Some societies won't survive. But those that prepare, they can not only survive, they can thrive. And so this is an example of when you have an effective partnership, you can really deliver amazing things. So for example, in just 3 years, here we have a snapshot of the translational pipeline of just the antiviral programs in Virex, where we have 3 molecules that have already entered IND-enabling studies, which is on this way to be testing in humans. We have the first company to be spun out, 4J Therapeutics, which licensed the programmable antiviral technology, where we can program or design an antiviral against any virus of interest. Their lead product is a universal treatment and preventative for influenza. To help accelerate those efforts, they've also received a contract worth up to $313 million to fully develop that. And there's about 9 other companies at latest count that are incubating within Virex at Stanford, other antivirals, anti-cancer, fatty liver, ALS, drugs. And so collectively, this is an example of what you can do for delivering anticipatory precision healthcare.
This is fantastic. And by the way, I promise that there will be a time for people to ask questions. But we've really taken it one level up, right? So I think we were talking about at a national perspective. Now, based on this thing, we're talking about multi-global centric centers of potential collaboration between different players. But also we're talking about a very quick and rapid, agile way of scaling things up. I remember a time when the only approach of transforming healthcare systems is largely centrally mandated. These days we believe in nobody goes at it alone kind of approach. And therefore we talk about partnerships and we have quick spin-offs, and then how do we scale it from an initial point of proof or proof of concept in one locality. So maybe we've dealt a lot with the system level side of things. Now I want to go up to a few levels higher into the value-based perspective. Maybe Tina, a question to you, because you're involved in multiple initiatives globally, and I think we always need to talk about trust because there's data involved. we also need to talk about governance. And the governance is a bit more complicated because you don't just have one single system, but you have multiple systems across localities. So what are the key challenges? So anticipatory healthcare depends on trust, data integrity, and governance. What are the key challenges, and also what are the most promising solutions for building on this trust data architecture that you have?
So I think, trust is at the heart of everything. Everyone needs to trust the system in which they're engaging. I mean, there's no point in having any technology, AI, if you don't actually trust how it's going to be used. So I think, at the heart of that is actually really involving citizens, people, in the development of these systems. So that is absolutely at the core. So a lot of the work that I've been involved with has been fundamentally about that, to actually build that trust in systems. So for example, citizen juries, I've been involved in all sorts of activities where a code of conduct, for example, that was at the heart of some of the initial work that the NHS, for example, in the UK, with the development of their AI lab, really focused on the code of conduct, the ethics around use of the technology. So I think these are really, really important sort of considerations. Going back, and I know it was so citizen engagement keeps on coming up over and over again. So going back and referencing the Human Genome Project, the Human Exposome Project, which is a multi-international endeavor. So the governance and the trust and the whole roadmap around that is at the heart of how they're going to be doing things. So engaging Global South partners, engaging citizens in this process, and some of the new developments that we're seeing in line with that around the world, and including actually in the UK with some of the work that I'm doing, is how do you actually, so here in the UK we've got a wonderful healthcare system which is straining because it's just not sustainable in terms of the demand, aging demographic, chronically ill populations, all the reasons why we need the Human Exposome Project to shift how we actually invest in health. But very interesting, they've come up, they've just announced some new data legislation which will open up access to data sets across the system and across health trajectories, so all the exposomic data that we need. And that's through the Digital Use and Reuse Bill, which will allow verifications, digital ID, which will allow us to connect up data sets. So, in fact, the previous session on genomics, they were talking about having standards and sort of harmonization and formats. It's exactly the same thing that we need to have a unifying way of actually sharing data, making it interoperable, and actually making it citizen-centered. So that's the big difference. So the legislation going through now is actually around the idea of personal data wallets. So the citizen is the control of the data. They can consent to this, sharing their data with any third party they wish to choose. Now that will spur the generation of new products and services that will help keep them healthy and well outside of hospital, connected up with the hospital system, of course, so that you can get that meaningful snapshots across health trajectories at an individual level, and then of course aggregated up gives us really meaningful snapshots. And of course, once you throw AI on it, you can get meaningful patterns of actually where is the risk actually of disease at an individual level and aggregated up at population health. And I think once you have that information, the whole socioeconomics and the metrics linking health with economic growth starts to become a reality and meaningful, because then you can actually see, hang on a second, I should be investing here in childhood health and good nutrition rather than here, and actually transportation policies, making people walk more. Suddenly it starts to re-gear the whole way that we think about health generation, health as an asset. But if you engage citizens in the process to actually get them to understand why it is that they need to engage with their health, what it means to help make sure your child is not eating junk food and should eat healthily, and to be rewarded and nudged through mechanisms, through government intervention, for example, making healthy food cheap, easy, convenient, not the junk food that is cheap, easy, and convenient at the moment, you start to have a whole new system change approach to health. So that's something that we need to be thinking about, and is already starting to happen around the world. Islands like the island of Jersey, which have a data trust in situ, they want to increase population health and individual health of their citizens. They have a whole mechanism in place where the citizens can share their data in a trusted way because they've been involved in the process. And all that, which is at the heart of developing that trust. People are very happy to share their data if they know that the purpose of their data, A, will benefit them, but also will benefit society at large. So I think data should be seen as a public good that can generate research at scale, be meaningfully used to give us the insight for products and services, next generation products and services, keep us healthy and well and out of the system, not leaving it too late and only focusing on treatments when we're sick. So I think that's what's needed, and you have to have citizens at the heart of that conversation.
This is fantastic, because I like the intersection between a trust data architecture versus personal ownership, you talk about data wallets, and then democratization of the data and information for overall societal good. This is actually a beautiful balance between them, because we talk about data all the time, we talk about data governance, but we very seldom talk about a integrated structure and approach towards making sure that that data comes to good for society, data for good, for example. And I think you're right, policymakers need to think more a little bit about that. So data governance is one point, but maybe another question, sorry, the question just come left, right, center, but we talk about governance, but Yacine, you are from Dubai Health. And these days we have a term called adaptive governance. The way of governing healthcare systems used to be very traditional, very process-oriented, very structured. Now, there is a trade-off between innovation and the lack of guardrails, as we mentioned earlier. So how can regulators balance innovation speed with safety, privacy, interoperability, while enabling anticipatory systems to flourish? So how do we make it flourish but not yet go into the pitfalls of not regulating things? And maybe if you could specifically speak about a sandbox initiative that you're involved with, it'd be very much helpful.
Sure, happy to cover that. I see familiar faces from regulatory agencies, so I'll speak with caution. But it's truly a collaboration in the journey. So I think we are talking about how healthcare is shifting from being reactive to more anticipation kind of approach. I think regulatory is following and will need to follow exactly the same type of shifts eventually. Even though by definition, a regulation comes always after innovation. You cannot anticipate innovation per se. An innovator will break a wall, a regulator will come and say, wait a minute, what are you doing? Not everybody can do that, so we're going to regulate. Nobody came with an AI regulation before AI. Nobody has now a regulation on space and on Mars living. By definition, it's reactive. Yet, we can also, at the early days of a trend, of a pattern, of a transformation in healthcare, try to be more into the anticipation and co-creation. That's the safety framework as well we can come with. And to make it practical, and you mentioned about the sandbox. So this is a consortium and a collaboration between Dubai Future Foundation, Dubai Digital, Dubai Health Authority, and Dubai Health, trying to bring together a sandbox safe environment for healthcare data, for public governmental-oriented research, but also for industry and private sector data access and collaboration in a safe, controlled fashion, where the regulators will also take maybe if I say it this way, a step back and let the industry and the researchers try within a certain limit and framework and come with innovation forward in healthcare based as a first use case in data. So we're a healthcare operator. We have our EHR system, we're on Epic. Dubai Digital will have the infrastructure, will have the compute. The Dubai Health Authority is the regulator and the sole regulator in the Emirates of Dubai. And if you are an industry partner, you are a startup now in the audience, and you are struggling to access to those healthcare data to train your models, to build your algorithm, and so on and so forth, you will have a one-stop shop to unlock those data and be able to speak to the operator, to the infrastructure leader, and to the sole regulator in the Emirates of Dubai. And they're also the governance of Dubai Future Foundation, who needs always and by mission be 10 years ahead. So that's the real example on the ground that is now open in the Emirates of Dubai, and it's available online. And we are collecting the use cases and expression of interest, and it will go live hopefully in January. So this is how concretely a regulator can take that leadership and through a sandbox model, but there are others where we can try to be a little bit more into the anticipation, into the test, fail, and trial to advance innovation in healthcare.
Fantastic. So there's agility, there's multi-party involvement because you have the right people there. And obviously, even for the private sector, that means that they're able to discuss with regulators directly in terms of bringing products to market. So it doesn't just meet the regulatory standards, but actually it actually makes sure that industry flourishes as a whole. Maybe this is a good question. So the sandbox is a responsible way of approaching anticipatory healthcare. Jeff, maybe a question on responsible innovation and ethics. So we're talking a lot about predictive, precision technologies. How can we use early detection responsibly? And you're a clinician. There are so many things out in the market right now. We're talking about liquid biopsy. We were talking about you're able to detect very minimal risk of developing cancer in the far future. There's a lot of information here. So whilst you may improve outcomes in the long term, you may have anxiety on the part of patients, or maybe even unnecessary intervention if you know that someone's cancer risk is increased. How do we make sure that there is responsible innovation?
Yeah, responsible innovation and ethics, we really need to prioritize that. We need our leaders to come together and make that a priority, such as maybe creating a council of industry technology experts, bioethicists, and task and fund them, and they impose guardrails on themselves before they created irreversible problems. And that approach has served time very well. It's allowed a whole industry to grow, mature, and yield fantastic new medicines and research capabilities. And it also avoided, I think, what would have been unnecessary, likely overzealous and counterproductive regulation, which had been required with the first crisis. And then also, I would say, a big part of my job at Stanford is to train the next generation of translational medicine researchers. And that involves not only developing and commercializing innovative preemptive care drugs and forming new companies, but also making sure everybody has access to those products at the same time at prices they can afford. So in all the companies I control, anything that comes out of Biorex at Stanford, we like a per capita GDP-dependent pricing with an effective anti-leakage model. So whatever we give to Mongolia stays in Mongolia. We don't make money there, but we have huge impact. We make our money in the first world, and I think you can do both. It's not a zero-sum game. And finally, also, we can leverage our innovative drug development technology to also bring a new high-value knowledge sector to local economies. So if we bring a Biorex at Stanford to Dubai, we can bring a whole new biotechnology industry, but at the same time, we can integrate right from the ground zero responsible innovation ethics, really build it into the DNA from the ground up. And I think that's super important.
That's fantastic. And something that we often don't talk about is the using of economic levers. For example, you talk about GDP-dependent pricing to ensure affordability, accessibility by contextual populations, because what works in one context may not necessarily apply to the other. Quite a good juncture before we break for questions, because I'm just checking on time. Perhaps to Tina. So Tina, this is a question on human connection. We've been talking a lot about data, we've been talking a lot about technologies, exposmes, we're talking about intelligent systems, that we sometimes forget that medicine started off initially vis-a-vis interaction between doctors and patients. So the question there is that as care becomes more predictive, becomes more automated, how do we preserve things, important values like empathy, purpose, and trust, to ensure that technology enhances, but it doesn't replace the human touch at the end of the day?
So we heard GDP as a framework to measure success of nations. We are, in the UK, we're looking at well-being and GDP as a measure of success of nations. And I think this speaks to the whole importance of understanding humans is really important. And I think this is a whole new frontier of longevity that we're trying to understand. And this importance of human connection, the feeling that you get when you're looked after and cared for, and when you love in your communities and your families and your close networks. These are really important, powerful determinants of our health and motivate people to do what they do to keep going, and how important sense of hope, meaning, purpose, human connection is in our lives. And we now have the science and the data to show actually it is a major driver of our health, well-being, and longevity, really important. So for example, in the Human Exposome Project, psychosocial stress, so stress in our lives is probably the leading problem in dampening our health. We're seeing a crisis, especially in our younger populations, in mental health. And that we've been having a lot of discussions around this age of AI and quantum and generative AI and AI agents and all the rest of it. This is part of the problem that we are creating a digitally, we're supposed to be connected more than ever, but we're creating a digitally disconnected population, and this whole feeling of loneliness, which is now an epidemic, is being reinforced by this disconnection that we are feeling in our societies as a result of digital and AI. So I think this is forcing another whole conversation about how we use technology. In the end, it is not about technology that is going to make us live longer and feel better. It is people who are going to be doing that. So we absolutely must preserve what makes us human and preserve humanity and what is driving actually our species. So this is a huge debate, and and I know there's a session on existential hope and all these sorts of things. These are really, really important discussions that we need to be having. And I think this whole, so human connection, so that keeps on coming up over and over again in all my discussions about the use of technology and how we need to embed that and how we create and nurture cities, communities, our neighborhoods, our bubbles that we create around us that can protect us from all the stress in our outside world with wars and all the rest of it that we keep hearing in the news every day. So I think, again, it comes back to how do we measure human progress? It can't just be about money, because actually the values that sustain human existence are absolutely not just about money. So we have to reflect that back and how we actually create the frameworks to focus our systems and the conversations that we're having at all levels of the system. So I think it's a really important debate, especially now that we're in the state of technology, that, let's face it, at the moment is being driven very much by money and profit. So I think we're in a very interesting junction, actually.
Really interesting. I think, there's been a flurry of questions, and the questions I like acronyms, right? So the flurry of questions has dealt with 3S acronyms. So we talked about the science, the technology. We talked about the system, what levers, economic levers, what kind of regulatory perspective you need to make sure that certain parts of the population are not marginalized. And then we talk about society. And we talk about loneliness. So that's why I like framing the conversation on the future of anticipatory care to a human-centered lens. So lots of questions. I did promise that we're going to open up the floor to some questions. We probably can take about 3 to 4 questions. And yes, see 2 hands up, 3. And then after that, we'll just close up with some ending questions. So to you first. So, yeah. And then after that, yourself. Thank you. Cheers.
Hello?
Yeah, can you turn on the mic, please? Yeah. And please identify yourself and keep your questions short, and then we'll jump straight into answering questions.
Thank you. Great panel. My name is Nojasad. I'm a physician and social entrepreneur for the record. I really appreciate how you, Tina, emphasized the role of citizens' engagement for systems transformation and also in translational medicine, Jeff. I really believe that we excel at translating research into industry use, but we really fall short on translating it into clear and relatable public messaging. So I want to ask you guys, what do you think, or what's your advice for media companies and influencers on how to help, best help us gain public engagement and mass trust, so that they, in their own roles, help incentivize their governments to invest more in better digital health and supportive emerging technology policies.
So the question is media ecosystem players, and how do they play in the strategic messaging? Tina, I see you raring to go. Yeah.
So this is a really important, the media have such an important role to play in this, and they actually, we underestimate actually the power of the media, and of course, and I work a lot with the media. So I think they're crucial players, and I think you're absolutely right. We need consistent messaging, following the science and the evidence, which really shows where our energy and our focus and our public messaging should be. Because I think what often happens, and especially nowadays, because the media and the whole sort of old gold-style journalism in search of truth, we know is very much at risk, and is unfortunately being dominated by the people with the power and the money, who can get into the media, and I would say, especially in the context of longevity, the general public are getting more and more befuddled and bemused and confused about what longevity should mean for them as individuals, because it is perpetuated, and a lot of the media is all about the latest study, the latest product, the latest this, the latest that, which gets a lot of media attention and may not necessarily be in the context of actually what is really good for your health. So I think that the media have a very, very responsible role to play, but I think as part of that, they need to be educated, and I think the education is absolutely so important, and it has to be about following the science and the evidence that is showing what works, and not only for those who can afford to pay for it, but actually what works across the board for people at every level of society. Because if we really want to generate health impact, we have to see it through the lens of actually what's going to impact populations at scale, not only those who can afford all the latest Instagrammable, stuff, which is unfortunately happening a lot at the moment.
Thanks, Tina. So I'll sum it up. Basically, how do you avoid media bias independent of economic interests? Yacine, would you like to go ahead?
Yeah, maybe just to add to that, because of course we can educate media and social media and hope for like a self-correction trajectory, but you can also sometimes put incentives or even force it. I take an example that we have in France. Sometimes we are too good at regulation and policies and we over-engineer it. But in all media advertising today, for any sugary or fatty products, it's mandatory to add a public health message at the end. It's mandatory. If you watch TV, you are on social media, you get something about your chocolate bar, the final message that you will get, it's about health. So this is maybe another angle to look at it.
Thanks so much, Yacine. Yeah.
And I just add, it's super important to not politicize public health. I mean, in my country, half the country doesn't want to take a vaccine now, because when we've messed around with trust and truth, and so it's another piece that has to be brought into the mix.
Thanks so much, Jeff. I'd like to go on to the next question. Perhaps just get more questions. Please identify yourself and
Hello,
ask.
Dr. Aisha Mutawa, and I hope I can make it short. It has been building up since the beginning of the session, and it has been boiling, actually, my question. So I heard systems, paradigms, I heard frameworks. I love the concepts of longevity, participatory, anticipatory medicine. Been hearing about it 10 years now. The only thing that I haven't heard in this whole, if I draw a map, I haven't heard anything about medical education. Medical education is still centuries backwards, and even it's worse nowadays. So the mindset of the clinicians, how can we produce a new generation of physicians who don't work with the patient on a prescription basis, which takes us to the R&D sector, which is, bottom line driven and everything. And the physicians, he meets the patient to write the prescription, not to care about what this human, I don't want to say patient, we're meeting a human who needs assistance. Maybe he's not that, or she is not that sick. However, they are treated like some sort of a subject to be injected or consume chemicals. And I would like, second question, please give me a wow factor in the area that you are addressing, because I want to hear something new. I want to see that we've evolved in these areas where we say, yes, this is the new things, let's take it and try to understand it and research more about it. Thank you.
I'll get someone to answer the first question. First question, how do we train the next generation of doctors? Do we need medical schools, for example?
We do. Better prepared and better equipped. Thank you so much for the question. And please don't take my answer as we've done it all, we know it all, and I'm bragging. Please don't. We are in a journey. At Mohammed bin Rashid University of Health Sciences, we introduced in the medical curriculum, year one medical students, one semester, design thinking and digital health introduction. Okay? Design thinking, the focus is to make sure that our future doctors understand how to address a problem and not focus on creativity solution, number one. Number two, design thinking is about human-centric design and patient-centric design. This is something we teach them in year one. Again, I'm not here to say, look, we've done it, we know it, but it's part of the medical curriculum, and it's now implemented here in Dubai and in the UAE. And now we are working as well into the new MD program to be launched in 2027, where it's going to be a longitudinal training. The whole point is how to prepare a future-ready healthcare workforce. A lot of challenges, a lot of priorities, but one of them is, at least what I'm in charge of, technology, human-centric design, by definition, as part of the medical curriculum. Is it perfect? Is it entirely effective? Again, it's a journey, but it's part of the curriculum. Just on the first answer.
I would just add, I think we should go back to the ancient Chinese way of thinking about doctors. You pay them when you stay well, not when you're sick. It is absolutely about that. And I think the whole, unfortunately, the medical system, the medical curriculum is unfortunately mired in the status quo why things don't change. It's all to do with the incentive structures that are keeping a gridlock on waiting till we need to be fixed before you see your doctor. We have to get out of that. We have to see the doctor and all the allied healthcare professionals as part of people to help you stay well. So I think until we get to that point, and again, it comes down to the economics and the incentive structures. We have to show that keeping you well, A, is going to release cash and in the system to actually benefit everyone in the system. So it is as fundamental as that. So I think, we need to, so I think, but on a more positive, and I think I speak to a lot of doctors who are going through the system. They all want to do prevention. They all can see that it would be much better to help people in a much more integrated, holistic way, because of course it's all specialized. And they get barely any education on nutrition in medical school. I mean, that's just ridiculous. I mean, nutrition is one of the biggest factors bringing down our health. I mean, it's just crazy, right? So, yeah, and so it needs a whole root and branch review. But again, it's part of the system change thing that we need to be thinking about and not leaving it too late. We have to move upstream. So there's a lot of really interesting training. So again, and this is more in the context of longevity. So the International Institute of Longevity, we're very, very focused on education, on all what I call the new frontier of longevity. So it is very much about prevention, harnessing the latest technology and science to actually move upstream in health prevention, because that is the holy grail of longevity science, and what clinics and all the actors in the system need to be thinking about. And everyone working together along people's individual health trajectories. You interface at different levels. You should be getting, seen and supported at every level of your own health journey, whether it's a clinic, whether it's a hotel, whether it's a gym or whatever. So we need an integrated approach to all this, and this is where the data and interoperability, the whole big stuff and AI starts to become much more meaningful.
So the keyword integration. In the interest of time, I'm just going to take one more question. Sorry, the second part of the question, what areas are new and not talked about? I think we talked about a few of them, but certainly this could go on for... Maybe I'll just take the last question from yourself, and then there's some closing questions which I'd like the panelists to... Yeah, go ahead, please. Yeah.
Hi, thank you for this immensely interesting and insightful panel. My name is Katharina Klein. I'm a researcher at the Bavarian Foresight Institute. I research in neurotechnology, neuroethics, and I try to combine that with foresight. So recently I did a study with the public on the acceptance of IBCI, so invasive brain-computer interfaces, in medical settings. And unsurprisingly, one of the most influential barriers and in their configurations was regulation, trust, and data privacy, right? Now, we've heard from you, and I think it was specifically you that said an innovation will fail without regulations. So it's almost impossible to scale it up, right? Now, when we look at neurotech in general, we have mostly soft laws. So there was a very recent framework of UNESCO, there's an IEEE framework. But what do we actually do to put all the stakeholders together on a table, and what do we do to actually make it human-centered and get a participatory approach in advance in order to actually help people with neurotech?
Can I just a quick one? Maybe Jeff, because you have this ecosystem. So the question is basically, what is a practical modus operandi to bring all the players into one platform and to make integrated decisions, as it were, with impact on healthcare system?
Yeah.
It's a tough one, all in one. But go ahead.
In 5 words. I mean, I think it really boils down to appropriate collaboration and have a common mission. But I guess I heard neuroscience and I heard a request for one wow factor. So I'll combine those into one answer. I'm a virologist, but the coolest thing that's just happened in my lab is a new treatment for ALS. ALS is this terrible neurodegenerative disease. There's a genetic form. You can put that gene into mice. They have severe weakness. Neurologists have this very sophisticated test called the inverted grip test, where you put a mouse on a wire mesh, you turn it upside down, see how long it takes to fall off. So the ALS mouse falls off right away. We give those mice once a day an oral drug for 7 days, and those mice are as strong as normal mice. It's the equivalent of a man in the hospital with ALS pulling off the ventilator and walking out. So to me, that's an amazing wow factor. And the coolest thing is, the woman who did the experiment, it was her first week in lab. So I told her don't get used to that, but that's my wow factor for this week.
Thanks so much, Jeff. I basically have 3 minutes or less than that right now. I'd just like Yacine to answer one question. And the question is that Dubai Future Forum is obviously specialized in convening global voices to shape what we have, in terms of future thinking. So how do we leverage on the power of global platforms like that? Because, with Dubai Health, you have many global voices as part of your initiatives. If you could just share your thoughts on how do we make sure that this kind of momentum of thought leadership exchange continues towards the future?
It's all about, I don't want to give a conceptual answer again, but this is all about connection. And connecting the minds will end up into partnership, collaboration, and kind of meaningful outcome. Just within this panel, we had 2 conversations where we're going to have a follow-up, potentially a project, and potentially something that would be delivered. I want to go back and reiterate something that was also raised about education, how we prepare the future, as this is about the future. Something we try also to establish and do is to make sure that our medical students, our doctors, don't work on silo. We only know what we know, we don't know what we don't know. And some of the cornerstone of what we do is we connect them with designers and engineers, because some of the challenges we are trying to tackle will never be solved only by healthcare professionals only. So it's connecting people, connecting mind, looking forward together, and bringing interdisciplinary, intercultural work.
Okay, thank you very much. Last question, one-word answer, because I'm literally going to be skinned alive. What is one action or shift that you would take to champion anticipatory care to the next level? Jeff, put you on the spot there.
Together.
Togetherness, okay. Tina.
Let's make sure we're asking the right questions, the societies that we want to live in.
Yes.
And I would say measure the exposome and factor that into the whole way in which we need to change the system.
Measuring
Move health
outcomes.
to prevention.
Fantastic. Yacine.
Stay focused on the problem, not the solution.
Thank you. And with that, please put your hands together for our distinguished panel of panelists. Hope you enjoyed yourself, and please feel free to have conversations with them. Thank you very much. Cheers.